Conversations, brought to you by the Australian College of Rural and Remote Medicine. Here we will talk with dermatology experts and rural doctors about ways to care for patients in rural communities. Sit back and enjoy the conversation.
So hi everyone, I'm joined by Joshua, Dr. Joshua Daly. How's it going, Doctor?
I'm doing well, thank you.
Good. So first of all, I just wanted you to give a little introduction to help us understand the rural and remote context within your working in. So could you briefly introduce yourself and your medical practice?
Yep. So I'm in Jamestown, South Australia, just about 3 hours north of Adelaide. And the practice here is very, very good. Been enjoying it. There's lots of support from colleagues around. It's a practice that covers 3 different areas. Here, Jamestown, Peterborough, and Orroroo. And so it's nice to work in that environment with other colleagues around. There's some midwifery services that are provided here locally, and some specialist services that come up to visit. But one of those is not dermatology, so it's definitely good to have been able to have the resource for Tele-Derm.
Okay, great. And what made you become a doctor?
Yeah, so growing up, so, as someone who believes in God having created this world and us as well, just as Jesus had lots of empathy for those around him and their sicknesses and illnesses, I too, from a very early age, enjoyed helping others in need and seeing the smile on their face from little things like that. I grew up listening to medical missionary stories like Hudson Taylor from the Inland China Mission, for example, and that really inspired me too. He and his family doing their medical mission work back in the 1800s in China, and so yeah, I really looked up to those role models and definitely wanted to do something similar when I had the opportunity. And so that's what I've done, and we've been off to Mongolia prior to coming back here to Australia for further training, and that's the goal, is to return back there and
Wow.
continue work.
Incredible. So was there a specific moment that did you have that click, or was it over a period of time? So
yeah, I think over time, I think it was. My father was a doctor as well, and he had shared with me his desires and his patients, and there was frequent conversation at home, and really enjoyed, and I could see that he enjoyed it as well. He had lots of job satisfaction that I could see from him, just from the interaction that he talked about with his patients and how he was able to help them. So it was really encouraging to me growing up as a kid.
great. And how did you first learn about Akram's Tele-Derm service?
I think it was through just going through all the learning modules, and just looking at what was of interest, and that caught my eye because it was a bit of a weak area. I trained initially in Mexico, and there we don't really have much of an issue at all with skin cancer. So it was a weak area for me, and that caught my eye, and yeah, it was very, very useful from there.
Okay, great. And was this when you were a registrar or
Correct.
after? Yeah, okay. Oh, great.
Yep.
So pretty early on.
Yep.
And before using Tele-Derm, I guess you started before you followed, but before using Tele-Derm, what were your main resources for dealing with complex or unusual dermatology cases?
Yeah, and that was pretty much just colleagues, but where I worked previously was much more isolated than I am right now. It was just myself or a locum, or myself and one other doctor in the previous places that I've worked, and so it was just asking a colleague, and it just fluctuated depending upon my colleagues' comfort level or expertise or experience in that in dermatology. So it varied, and so sometimes, yeah, it was painful because then you had to say, well, I don't know, but I think I need to send you a referral, and then yeah, you can see the difficulty with patients having to travel so far, and then it ends up being something that really one could have resolved on their own if they had the knowledge. So or means by which to communicate to someone who did have the knowledge and more readily, resolve their issues without having them have to travel so much.
Okay. So would you kind of following on from that, would you say that the availability and accessibility of dermatology services in South Australia as a whole were limited, or what did you say mostly rural areas?
Yeah, I've worked in rural remote Queensland and there as well. Yeah, it's you're limited by where you can have. Sometimes there'd be in Queensland. I remember there was a GP that had his area of interest in dermatology, and he would do rounds. But that wasn't on the day with your patient and sitting in front of you, and it would be you know 3 times a year or something to that order, and you have a patient that's in distress from, like in this several situations, they're scratching themselves to pieces, and how do you help? So
Yeah. Okay. So if you did want to kind of refer to a dermatologist, where would be the nearest one for you now? Would it be Adelaide?
at the present there is a dermatology service an hour away
Okay.
in Port Pirie. But yeah, there's the referral time frame, of course, from time of referral to actually being seen. Out where I was previously in rural remote Queensland, then yeah, that was definitely many, many, many hours to get to someone
Yeah.
from dermatology.
What would the wait times be? How long?
Um, yeah, definitely more than a month for sure.
Well, okay.
Um, yeah, definitely, yeah.
And what would that be compared to, I guess, Tele-Derm? How long would you wait normally
Yeah,
if you
so
submit a case?
well, no, well, that's the nice thing. It's good. It's quick. I mean, you can organize all your bits of information and then upload it. And then yeah, within a couple days or a day even, you can have a result and back into your into that site, and then you'll log an email, and you can be aware of it and be able to proceed and with management or investigations.
Okay.
So yeah, it's definitely a super contrast in that
Yeah.
regard.
So I guess it's Tele-Derm has kind of influenced your kind of ability to diagnose and treat patients locally rather than refer them to a
Yeah,
dermatologist.
and the travel that's involved, and the
Yeah.
time, and the angst, and what is it, and all that sort of thing. So,
Yeah.
there's definitely a lot quicker path to maybe not even if it isn't knowing exactly what it is, at least you have someone who has expertise in the area, dermatologist, that's giving you advice, and you have a plan to move forward with,
Yeah.
which is really, that's reassuring. That's taking the question marks out of the picture
Yeah.
and giving you a good plan.
So I guess some cases you might submit might not you might not need to, I guess, worry about. It might not be a serious case, whereas others, at least you'll know if it's serious and you can take the
Yeah,
right steps.
yeah,
Yeah.
yeah.
Okay. And you did mention a little bit about the response time for Tele-Derm. What about I guess, the quality of advice you receive through Tele-Derm?
Yeah, no, very good. I've been very happy. And with follow-up too, there's been multiple um responses back and forth. I have a further question, and it's not like, well, I gave you a plan and then that's the end of that. It's there's good follow-up and feedback after, even if you have further questions. And so from that, it's been very good um, and very helpful. So yeah, I've been very much appreciative of it.
Okay, great. And And would you recommend Tele-Derm to other doctors?
Oh yes.
Yeah.
Yeah.
Okay.
No, definitely. My colleagues have heard about Tele-Derm and through me, and been keen to support it. Because not only that, then you have all the cases within Tele-Derm to go through, to just get your own eyes trained at looking at different pathologies and being more sure yourself. But then you have also the training sessions that Dr. Jim Muir puts on, and those have been very helpful, just for being able to see things maybe that I myself won't be resolving. They still need to go to a dermatologist, but if I'm not aware of it existing, then I'm not going to think about it. So even from that perspective, I think it's been very good. Dr. Rachel Foster as well, in WA, she's been very helpful too, and in answering questions put on that I've had in the past. So that's been good.
Great. And I guess why should doctors in South Australia use Tele-Derm specifically? Or would you say all rural and remote doctors should be using it?
Yeah, I think definitely there's a, I mean, I guess the question could rather be why not? Why not use it if you have access to a dermatologist? You know, you upload images, you upload your questions, you put your history in, and you can get a response in a couple days or less. Why would you not want to have access to a dermatologist, which is we all know we have a struggle with that, regardless of where you live. Even if you live in the city, you still have wait times. So there's I don't see any way of beating around the bush on that one. It's just a win-win for you and the patient.
But I'll pass on to Canvas now anyway, as Canvas is a trained overseas practitioner, so is a bit more, I guess, qualified to talk about case-specific questions.
Thank you very much, Dr. Dari, for accepting our invitation and joining to this interview. I'm Kambiz, an overseas trained practitioner, and currently I am the administrator of Tele-Derm service. I'm going to ask some questions about the case you submitted in June 2023. It was about a chronic macular papular blanching rash in a 84-year-old male man. As you submitted this case in June 2023, obviously you might not be able to recall all details, but just I'm going to ask some questions. Maybe you can help us. Could you provide a short overview of the patient's medical history and describe, their skin condition? Do you remember?
Yes. So this gentleman, he had been very normally a happy chap, but very unhappy because this has been going on for approximately a year that he's having this rash, and it was in certain patches, and it would flare up during the heat. He'd get some reprieve come winter, but not completely ever go away. And this rash was on his both flanks, up on over his anterior chest, on the clavicle area. And he had some patches on his sacrum as well. And it was very pruritic, and it was just he would scratch at it, and it was just really bothersome to him. There wasn't any, spreading. It would just sit in those patches, in those areas, those specific areas, and just, bother him to no end. So he hadn't had this before. He wasn't aware of much in the way of other skin issues besides actinic keratoses and from solar damage that as most of the farmers out here have. But this itchiness and rash was just really was bothering him. And he's tried numerous things, lotions and potions and tablets, and nothing was really making things any better for him. He was systemically well, and there was no actual blisters that I could see. There was no palmar or plantar involvement. And yeah, these patches would just sit there and not, not budge, not spread, but not go away either.
Okay, thank you. And what different diagnosis did you consider for this case? What was your, initial differential diagnosis? Do you remember?
Yeah, so I don't know. I mean, it's a rash, and you scratch your head and what could it be? I wasn't sure. I don't exactly remember what all went through my mind at that stage, but what I do remember is that, yeah, I don't know what's going on with this man. It's not spreading, it's not getting worse, but and it's not making him systemically unwell, but it's it's definitely bothering him. I mean, a contact dermatitis or something, I would have expected to be more broad spread and just these very isolated patches. So no, I wasn't, and again, like I say, it's not my strong suit, skin. And so, yes, I wasn't coming up with any great ideas as far as differentials go.
Okay. And were your initial diagnosis and management plan different from the advice given by Tele-Derm specialists?
Yes. So initially, I had advice to go and take some biopsies, and at least that way we can rule out some unusual things, particularly, or potentially come to a definitive diagnosis with not just one biopsy, but multiple biopsies, which I probably wouldn't have thought to do initially. So that was good. Multiple would be increasing our chance of getting a good representation of what was going on. So yes, that was good advice that I initially hadn't thought of doing. Grover's disease, irritated seborrheic keratosis, or lichenoid keratosis, or an allergic contact dermatitis, or miliaria were the differentials that were first put forth. And along with that was, a plan to deal with what may be Grover's disease and see how we got on.
Thanks. And what specific insights or support were you seeking from Tele-Derm for this case? Was it diagnosis, management? Mainly?
All of the above. So yeah, I was at a bit of a loss, and I think he had seen others as well, and no particular diagnosis had been reached. So yeah, I was looking for help for how to investigate it and what can we do in the interim until we do come to a diagnosis.
And my last question is, were you able to conduct a follow-up with the patient after the Tele-Derm consultation? Do you know what happened to the patient?
Yes, so for this gentleman, we did do the biopsies, multiple biopsies, and the multiple biopsies, they didn't give us a clear diagnosis, but there was a number of further differential diagnoses that was and plans that were provided quite quickly from Dr. Rachel Foster. When I submitted it, like the next day, I had a response when I uploaded my images and progression of this is what we implemented the first plan, and this is the progression. This is what the histopathologist said. The next day I'm getting a response back, so that was very good, and that was very helpful. Later on, he progressed and ultimately did get better. So through the help of Dr. Rachel Foster, I much appreciate it. So and he's a happy chap now.
Good. Okay, thank you very much. Pami, hand over to you.
Yeah, no, I really appreciate you coming for a chat, and we'll let you know when I guess it all goes out and send it to you before it does go out. And is there anything else you'd like to add about Tele-Derm or about the college in general?
Yeah, I think it's it's a wonderful service that we don't have anything similar at all at our disposal that I'm aware of. So it's good not only for help from a diagnostic investigative management perspective, but it's also very, very helpful from a learning perspective as well. All the content that's on there, the slides, the case studies or cases that are on there, with images and reports, and even there's the quizzes that are sent out from time to time as well, to get your brain thinking as to what might be going on. Then later on, the answers revealed. So, I think it's a very complete, comprehensive resource for us as GPs, rural and remote. And I think, it's very, yeah, I would definitely encourage everyone to think of it as why would I not want, this resource, next day within 48-hour response time from a dermatologist, resource for my patients.
Perfect. Thank you very much. Definitely pass that on to, well, I guess Canvas is here. So, yeah, no, I appreciate you coming on and chatting to us.
Anyway, thank you very much, Dr. Dali. I understand, you are so busy, and I really appreciate it that you have put in some time for this interview.
Thank you for listening to another episode of Tele-Derm Talk. Please share with your friends and work colleagues if you are enjoying the conversations. You can reach the Tele-Derm team by email at ehealth.acram.org.au or visit the Tele-Derm webpage on the Acram website. Until next time, take care.